Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's question of the week, Dr. Pane, the question is, person is trying to find the right doctor for a labiaplasty in Florida. She's in the process of finding the right doctor to perform this, and she doesn't want things to come out terribly wrong. So I know this is an area of specialty for you, so Dr. Pane, what do you suggest?
Well, it's a great question. A lot of it is common with any cosmetic procedure. You want to be sure that the person you're selecting knows what they're doing with that procedure, has experience, and in the area of a labiaplasty, perhaps more so than some other procedures, you want to make sure that they're coming across to you and listening to what you're looking to do, because it's an area that people are trying to do surgery in, and because it's been more, it's an area that's been more in demand, so to speak, from patients. And it is true that a labiaplasty procedure, a basic labiaplasty procedure, may not be very difficult to perform that surgical operation, but it is difficult to perform it well with a low chance of revisions, touch-ups, and there's also a lot of other things that can be done in that area. So when somebody asks me what they want for a consultation, I got to be clear about what they're looking for. Most common is reduction of labia minora, but there's reduction of labia majora, there's volume restoration of the labia majora, there's work on the clitoral hood area, and sometimes it's revisions of previous labiaplasties. There could be a lot of things that could happen. So those are all things to take into account. If somebody does a lot of those different areas and also does the internal work, they might be more comprehensive labiaplasty surgeon that can address pretty much whatever your concerns are with the area. So that is something to keep in mind. Overall, with before and after photos and so forth, their overall experience and how you connect with the person. There's also other techniques to do the procedure that can limit the post-operative discomfort. And what's their rate of revisions or touch-ups? You try to get that as low as possible. It's never zero, but if somebody is giving you the sense that there's really a low chance of any issues, that's good to keep in mind. With labiaplasty, when you talk about the labia minora, there are different techniques of doing it. Some surgeons are pretty regimented and they will only do it with one technique. They may not say that to you, but with more questioning, you can find that out. There's actually two major ways to do the procedure. I personally like surgeons that will do both ways and kind of individualize it depending on what you're dealing with. Which is how I do it here at my practice, and I think a lot of the experienced labiaplasty surgeons have a similar approach in most cases. So that's the basic overview on how to select a labiaplasty surgeon. The same as any other cosmetic procedure with a few features that are unique to that procedure.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to us on our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.